Thank you so much. I'm really excited. I have Dr. Lucy McBride, my favorite COVID go-to. I've learned so much from Lucy throughout the pandemic, and I'm so excited to have you here. Hi, Lucy. How are you?
Hey, Jessica, I'm great. I'm really happy to be talking to you today.
I thought the purpose of this podcast could be we could talk about some of the common concerns I've been hearing from parents recently and hopefully provide data and maybe some thoughtful discussion around why we can worry less about those questions. And before we get into that, I thought I would just start by asking you to tell the audience that's listening a little bit about yourself. Like, who are
Sure,
you? Where do you practice? What do you do?
sure. So, my name's Lucy McBride. I'm an internal medicine physician in Washington, D.C. I'm a primary care doctor. I've been practicing for 20 years. I see patients ages in their teens to in their 90s. My oldest patient, I think right now, is 92. Um, and my interest has always been in helping people recognize the inseparability of mental and physical health. And also like to take some of the fear-based messaging out of the driver's seat. I wish there were more school-based mental health services. One of my friends here in DC works in Ward 8, one of the hardest hit communities from COVID and generally sort of marginalized area. And it's cool because my friend Anna Walker, she's a pediatrician and she staffs the health center that is annexed directly to Anacostia High School. So those kids have, like, it takes away so many barriers to them getting, their vaccines, COVID
Right.
and otherwise, and counseling on safe sex, just primary care right there.
But I would even add to that, for those that can't see a therapist or don't see therapists, I think, like, for myself, I get a lot of therapy from talking to friends, or I know when I was in
Yeah.
high school, I would talk to my teachers. And I think we really have to think about the effects that kids feel when they're limited to see their friends and they're limited to talk to their teachers without a mask on. I mean, that's definitely a barrier to getting close and feeling intimate or feeling able to, I think, to probably confide in the way that they would before the pandemic. And I think, relationships in general, I think, are important to foster.
Yeah, social connection is huge.
Right.
I think we
Right.
forget that's part of the way we remain healthy and have mental health. It's not to say that every child who's been masked has mental illness or that, but I think it's a little naive to think that this whole like kids are resilient, kids don't mind narrative. I mean, maybe your kid doesn't mind, but kids are resilient, but not indefinitely.
Right.
It's just that it's not normal. It's also not sustainable. And sure, we masked up in 2020, but this is 2022, right? Like,
Right.
it's a different
It's
situation.
different.
Not to mention, if we have to wear a mask again for some other wave, like, it's not going to be very palatable to people if we just say, mask in perpetuity, right? Like, that's just not. I mean, and again, anybody who wants to mask can mask. Like, there's no
Right.
judgment there whatsoever. It's just a mandate. The burden of proof on an intervention. The burden of proof is on the intervention when the norm is seeing faces, and we just don't have compelling real-world evidence that masks meaningfully reduce transmission of that virus in schools with a mandate. In fact, if you look at the data from Nevada right now, Nevada dropped the mask mandate in February 10th to be exact. And if you looked at their Omicron wave, it's in free fall. And then you look at February 10th, and you would have expected it to go up.
Right.
It free fell more.
Right.
A couple of my epidemiology friends are following it, and it actually, the rate of descent increased despite the masking lift in schools, which is, again, people say, well,
Almost hard to believe.
how is that possible that a mask doesn't work? And I totally understand that. It's like, that does not make intuitive sense.
Right.
But if you think about it, we're talking about the real world, where kids are in schools for 6 to 8 hours a day, right? Like, I mean, my kids report that in school, like, they're not wearing their mask perfectly all day. They're like taking it off to eat. They're taking it off to do whatever. They're scratching their faces. Like,
Right.
if COVID's in the school, it's in the school. The mask is really not going to do. It's not going to do a whole lot. So anyway, but it's obviously a culture war that is a hot button issue.
No, absolutely. And I feel bad that it's like that because really what I think at the end of the day, we all just want our kids to be safe. We want to keep ourselves
Correct.
safe.
Yes.
And so question for you. I mean, this is a good segue. I think I really like on this podcast to help parents, arm them with information, hopefully help them worry less, feel better. So on the subject of masks, as mask mandates are now being relaxed across the country, a lot of parents are nervous about it. They're asking
Yeah.
me, is it okay if I send my kids to school without a mask on? How would you help them feel better about that question? What would you say to them?
So it's a question I get all the time because, as I said, I have a lot of patients who are parents, and you know, and like you, I've gotten the question for 2 years: Can I do this? Can I do that? And I try to reframe the question. It's not can you. It's let's think about the benefits and let's think about the risks, right? So, like someone asked me, I think it was like right before the Omicron wave, like, can I go to my daughter's wedding without a mask on? And I'm like, it's not can you. It's like, what would it be like to wear the mask at the wedding versus what would it not be like? And then let's think about your risk of like missing out on the wedding because you're masked the whole time versus like what's the COVID risk? Because that's the question. So similarly with parents right now, I mean, the way I try to frame it, first of all, I always say, please talk to your pediatrician because if I'm not your child's doctor, like that, obviously you should defer to your pediatrician for that child's unique medical advice. But I do have my finger on the pulse of the data. So I would say, you know, generally the risk for severe outcomes from COVID-19 for kids ages 5 to 11 is if they have no underlying health conditions is minuscule. I mean, you saw that study from Germany, right? Like they couldn't even, it was just,
Amazing.
it was like zero. Again,
Right.
which is not to say that kids with comorbidities are any less valuable. It's to say that we need to do everything we can to protect those kids with multiple comorbidities, but that parents are allowed to feel relieved when they hear that kids who are generally healthy face such a tiny risk. And so the other thing I would say is, you know, it depends on your child. Like I have a parent whose child is hearing impaired and she's 6 and she's vaccinated. And that child has had a very difficult time learning to lip read and learning language. And she's vaccinated, and you know the rates of COVID are free falling. And if she were to get COVID, it would probably be a milder illness, just because she's a healthy kid physically. So you know, for that child, it's a no-brainer to the parents. Like they want the mask off for their child to be able to learn and develop. I mean, it's traumatic to not be able to learn speech. So I think it depends on the kid. But I think right now, I mean, to people who are saying that we should mask in perpetuity, I simply ask respectfully, so what is your endpoint? Because everyone says, oh no, I'm not talking forever, but like what is your endpoint? Like what is the endpoint?
Right, if we can acknowledge that COVID's never going to be zero, which I think most people agree that it's never going to be zero. Right, what is our endpoint?
What is your endpoint? Because I mean, again, like people say, well, in Asian countries, that's more culturally normal, but this isn't Asia, you know?
Right.
This is, so, but it's also to say you can mask if you want to, but I also think parents, well-intended, want to keep their kids masked, but if they are masking now, I would ask when are you not going to mask? And I think a lot of it, for a lot of the parents I'm talking to at least, they want to mask more, or, you know, continue to mask their child more just for a feeling of comfort. But the problem is the more you push an intervention, the harder it is to take it away, just because of the anxiety and the fear and, you know, the kids not wanting to be called out. Or so, you know, just like you do in your patient advice, like I try to make sure, because fear is so normal and fear is so common right now, and anxiety is so understandable after 2 years of living through this horrific time. We want it can be an occupational hazard of having anxiety drive our decision making and anxiety driving our behaviors. So this is where, you know, you just really need to talk with your pediatrician and your doctor to find out, like, let's make sure we're calibrating our fear to the level of actual risk.
Right.
It's like if your kid, you know, because kids face a bigger risk of getting in a car or going in a swimming pool than they do for severe outcomes from COVID, and you let your kids drive. I mean, maybe not themselves if they're not 16, but you let them in cars and you let them go in swimming pools, or maybe you don't, and maybe that's your risk tolerance is just lower than someone else's, and that's fine. It's just have self-awareness about how you're making decisions, so that you're not actually accidentally doing harm for yourself or your child.
No, absolutely, and I do think some people feel like they're wearing a mask to protect society, that there's a duty to wear a mask to help others. And I think my answer to that is, you know, I feel bad about that. I wish there weren't vulnerable people, of course. But I do think if you really are immunocompromised, for example, you know, those are the people that we really should promote wearing N95s when they're in public, really promote the idea of one-way masking, that's an option, and make sure that those people are really getting vaccinated and boosted. because I
That's the
do
first
think,
thing. That's the first
yeah,
thing. Yeah.
that's right. I agree. I agree. Vaccinating and boosting. Because I do think in some way, if we really rely on masks as protection, and as you've just stated, there is faulty data. They may not work as they probably aren't working as well as we thought they were working. I do also think they're giving people a false sense of security. Like if you're really immunocompromised
Absolutely.
and you feel comfortable going to the grocery store because everybody's wearing a mask, maybe that's not actually a good thing. Are you following my
Absolutely
logic?
right.
Yeah.
I mean, I think it gives people a false sense of security. Like my immunocompromised patients, like I have a liver transplant patient, and she was asking me if she should mask. I'm like, if I were you, like I would no more rely on that mask in a crowded, like metro or whatever during a surge. I
Right.
just wouldn't go.
Agreed.
I mean, if you have to go, wear the N95 mask. But right now, as Omicron is really going in retreat, um, the main things I'm recommending to her as an immunocompromised patient is vaccination, boost, and she's actually had a fourth shot because she's so immune suppressed. Number two, we have made a plan that she can get Paxlovid, which is the oral antiviral should she get COVID-19.
Great.
And I've actually signed her transplant team got her set up with Evusheld. Evusheld is a twice yearly injection of monoclonal antibodies that is a preventative. So she has 4 shots, Evusheld twice a year, and we have made a plan to get her Paxlovid if she's exposed, because we all will be exposed at some point. Instead of having to mask and think that that's doing something for her, because otherwise she would even have to mask her whole life, and she doesn't want to. She's willing to take the risk of getting COVID, and we would just manage it like we would the flu before. It's
Right.
not, flu and COVID are not the same thing. Just to be clear, flu and COVID are not the same thing. I don't. They're not the equivalent.
How dare you say that?
They're not the same. They're not the same. And COVID is like a vascular disease, right? It's not flu.
Right.
They're both respiratory, but COVID's they're very, very, very different. But
Right.
what I try to do is try to help contextualize risk so people understand like so because it's helpful to compare things to risk we took before the pandemic just to frame things, but it's not to say that they're the same.
And I also think people will say things like, well, what's the big deal about wearing a mask? And as you said, that might be okay for some kids. But
Sure.
I love seeing faces. I want my kids to see faces. I want my kids to know how to interpret emotions, how to get along with people, how, I have a kindergartner. I want her to learn how to read. I'm sure I can tell it's really hard to learn how to read when you can't see, your teacher's lips and what they're really trying to describe. I want them to know faces that aren't good faces, who to be, who strangers are and who to welcome. I just think it's nice to see faces. And I think that's important to acknowledge that we're a social society and we look at each other and we benefit from looking at each other. So to say otherwise,
100%.
I just don't think is being
cultural
honest.
norm. I think it's frankly to me it's quite odd in a way that we have to explain that seeing faces is the norm. Like it's a cultural norm, which like it's bizarre that it has to be defended against. And again, you can wear the mask all you want. It's just that I think there's a reason we don't mask all the time, or pre-pandemic we didn't. It's because, as you just said, we are social animals and we are a social culture. Right. And there are a lot of nonverbal cues in the human interactions that we have every day. Right. And taking those away for 2 years, especially for developing brains and in developing relationships, again, it's harder to quantify, but it's not zero.
Right.
And if you have an intervention that's doing not much in the school as a mandate, and then the harms are non-zero, it's really time to think about getting comfortable with not masking and taking the risk of getting COVID, which again, no one wants to get COVID. I mean, we've done everything we could for the last 2 years to not get COVID. Right. But but at some point we all will be exposed. It doesn't mean we'll be infected or get sick from it, but it's going to be woven into the fabric of our everyday life, just like the other 4 coronaviruses has been, and like RSV and flu. Not that we wanted to.
The other viruses we live with, right?
Not that we wanted to. It's just reality.
I think you make a good point. I think, given that COVID is so low risk for children, of course it's not zero risk, but certainly compared to adults, it is very low risk. Given that masks probably aren't working as well as we thought they did, given that rates of Omicron have dramatically decreased, I think it's worth trying if you want to try. For those that feel better in their masks, of course they can keep them on, but I think it's worth trying. And if we see it's not working, we can always change course. But if not now, when? in my
If not
perspective.
now, when? And I think just like any change, it's normal to be ambivalent. It's normal for
Right.
kids to be apprehensive and fearful. I mean, I think a lot of kids are worried about like not follow, like looking like they're not following the rules. I think kids have been burdened with thinking that they have to mask to prevent old people or immunocompromised people, which is just an unfair burden, in my opinion, on children. Now
I
that we have
agree.
vaccines, boosters, antivirals, Evusheld, like kids, in my opinion, shouldn't shoulder the burden of protecting older immunocompromised people who are the people who are at highest risk for poor outcomes when they have all those tools. I mean, again, maybe that was okay in 2020 for like the sort of flatten the curve little stretch of time, but 2 years, it's a lot to ask of children
Right.
and adolescents. You know, one of the reasons I'm so interested in kids and adolescents and mental health is because, you know, kids and adolescents grow up to be my adult patients, and so many of my adult patients who have challenging relationships with food or alcohol or interpersonal relationships and, you know, bad habits and you know, anxiety, depression, you know, so many of those patients, I would say all of them in some way, like the roots of those behavioral challenges and sometimes mental health problems are from childhood.
No, and as to your point about how much childhood makes a difference, I worry a lot about, when I see my kids, I want to make sure that they make friends without worrying about getting sick. I think we've instilled such fear in our children. I do worry that what is that going to, how will that manifest in the years to come when they start dating, when they try to make close friendships? Are they going to be, taking a too far of a stance, or have some distance from their friends because they're worried about getting sick, or I don't know. I just worry that it may sound silly, but I do worry that in the future it'll
No,
have some repercussions because
I
there's
think
so
it's
much.
good. And I think as parents, like, I'm a big believer in talking about things that are hard with my kids, for better or for worse. They sometimes like run for the hills when they can smell an agenda. Like, let's talk about relationships. Or I said to my daughter like a couple of years ago, I was like, let's talk about puberty. And I like popped on the side of her bed and she was like, oh my God, Mom, you've got to be kidding me. Like the let's
I
talk
like
about
that.
puberty opener. Um, she's like, how about we don't? But my point is, like, I think
At least
it's
she knows
talking
you're there
about
to
it.
talk to if she wants to.
She knows. I'm available. But I think talking to kids about these things and sort of normalizing the anxiety and fear about change, and normalizing
Yes,
the notion that like maybe your school is going mask optional and that's going to be weird, and
that's good
explaining to them the
advice.
fact, like, look, your teachers have been vaccinated and boosted. I mean, hopefully they have been, and masks were a temporary placeholder, and you don't. This is a good thing, and let's try it. Maybe you want to wear a mask half the day and see how that feels. Just look. I don't need to tell you how to counsel your patients, but this is what I tell my patients.
I like it. No, and I think to your point, I think we've sort of underestimated or under discussed how well the vaccines have helped where we needed to help,
Yes,
and that
that's
is
it.
for the adults, for the vulnerable, and so I do think having that makes it a very different place right now than where we were 2 years ago. So now, another question I get from parents, they're worried because as the mask mandates relax, especially I think, for those listening, there was new data about the vaccines for 5 to 11-year-olds not being very effective, or as effective as we were hoping. What do you say, or what should I say to parents where they're worried that kids are not, we've talked about how good vaccines are, and kids 0 to 5 have not been eligible for vaccines, and those 5 to 11, the vaccine's not working as well as we were hoping. How should we make parents feel better about moving forward in life when their kids are not fully protected with vaccines as adults have been?
Right.
What would you say?
I think
That's a
it's, I
long
think it's an
question.
example of like, let's not make the perfect be the enemy of the good, or
Yes.
even the perfect be the enemy of the amazing. The vaccines continue to work where we need them to work. I mean, the vast majority of people who have died from COVID-19 are unvaccinated adults.
Yes.
Again, it's not to dismiss the children who have died from COVID-19, and every loss of a child is tragic regardless of the cause. It's simply to look at the data to say that the vast majority of people who have died from COVID are unvaccinated adults, or non-immune adults, I should say. And the vast majority of people who are vaccinated and are ending up in the hospital are adults who have usually 3 or 4 underlying health conditions, and those are my patients who we work really hard to reverse the underlying health conditions, get them vaccinated, boosted, et cetera. So I think it's important for parents to realize that, yes, the vaccine looks like it doesn't prevent infection as well as it did, but an infection in most kids is not a catastrophe, or it doesn't end up in catastrophe. It just doesn't. That's the data.
Right.
And the kids who for whom it's more worrisome, those kids need to be protected with other ways, like work on their obesity and their underlying conditions, work on their diabetes, get a tighter control of their diabetes. If they have asthma, which I know you don't consider right as an underlying health condition but work on getting better control of your asthma, because preventing the underlying conditions is one of the things you have control over. We don't have control over the virus, which is here forever, unfortunately, and it just is.
No, it's true.
So
I think,
yeah.
Yeah, obesity is the number one comorbidity risk factor for children to be admitted to the hospital, and that's something that we actually can make a difference on. It's hard to do, but you're right, we can't ignore that.
It's hard to do, and I think, I don't know, the obesity issue is so fascinating, interesting. It's such a complex topic, right? Because obesity is not just about, for some people it's about lack of access to healthy foods, right, in certain parts of the country. For some people it's about an emotional sort of mismatch between, or just sort of a dysregulated behaviors. And then for some people it's simply not being able to have enough physical activity because they've been on screen so much and eating junk food because they have more access to it at home. So it's like all those things need to be unpacked. I think the relationship with food is extremely common, and then children, the roots of those relationships are laid down in childhood and show up in adults.
And I would say the interesting thing about the COVID restrictions, where we've tried so hard to avoid getting COVID, we have these unintended consequences that have resulted, I think, in weight gain. If you think about it, when we kept kids home for fear of COVID, when we closed the parks, closed the beaches, kept them inside, I think that worked against outcomes for COVID. So, to your point, everything, there's more than just... Right.
In the panic spring of 2020, maybe it made sense to remember I was wiping down my gallons of milk too in March 2020, and then you realize, wait a minute, this is a respiratory virus, and then we just didn't adjust and adapt with emerging data, and then we have basically just scared the crap out of parents. I just feel so badly for parents. I feel so lucky that I have a medical degree and an ability to look at the data, and I don't look at it myself. I do, but I'm in constant communication, literally constant communication with people like you and epidemiologists and public health people, just to make sure that I think it takes a village to understand complex data. But I feel so lucky that I have that, because otherwise I think I'd be anxious too. I think my son graduated from high school in the spring of 2020, and I didn't let him do anything. Graduation, all that stuff was canceled, but I was just terrified. And then you look at the data and an emerging information, and you're like, wait a minute, the vaccines are amazing. There are harms of lockdowns, right, on our emotional health, our physical health, societal structures, our economy. It's time to think more broadly about getting through this.
You've adjusted as the data has become more available. That's and you've changed your ways, which I think is really good, which is how we ought to be.
There's no way around it. It's only through it.
That's right. Yeah, and looking forward. I think about that a lot when we talk about how many Americans tragically have died or how many of us have suffered loss. But I do think we have to remember that and pay attention to that and learn from that. But I also think it's so important to learn how to move forward.
Absolutely.
But
and moving forward is not mutually exclusive with mourning and grieving the things we've lost and processing the trauma and hoping for, but we can do hard things, right? We can walk and chew gum at the same time. We can protect vulnerable people and allow ourselves not to feel burdened, but with having to mask every day because it's just the data does not support you needing to do that for society, at least especially for kids. I think people also don't know this, Jessica,
Yes.
We've talked about kids as like viral vectors and vectors of disease when kids are really just kids, right?
Right.
Kids transmit the virus less than adults do. That Catalonia, Spain study that came out, that was like, I mean, in addition to other sort of amazing contact tracing studies back in 2020, 2021, kids transmit so much less.
Right.
You know, if you're going to get in school transmission, it's going to be from an unvaccinated teacher to a kid, not the other way around, typically.
Right. It's not to say that kids can't spread it, that they can't get it, but I do think that we've underappreciated how well kids have done during COVID.
That's right. It's a hard balance to strike, because it's interesting how in the polarized, politicized, stressed out world we live in, when you talk about data in context,
right,
and you're offering reassurance by contextualizing data, that gets confused as a dismissal of someone else's lived experience, which it's not. I mean, that's our job, is to contextualize data.
Absolutely.
I would make the argument that anybody who says that kids are all resilient and they don't mind, I mean, that to me is dismissing a different type of problem, people's invisible suffering, or kids can't always verbalize that this bothers me, right? Like, kids who live in traumatic situations often don't say that they're having a hard time, right? Like,
right.
And again, wearing a mask is not the same as being like a victim of childhood abuse. I don't want to say it's child abuse. I'm simply saying that I think we need to listen more,
yes,
and understand people's lived experiences, and not dismiss something that you just don't have experience with yourself, maybe. Like, if your kid is pandemic proof and is done fine, that doesn't mean that every child feels the same way.
So I'll tell you I experienced something with my son yesterday. I have a very easygoing son. He's very happy-go-lucky, very sweet, very easy. And I never thought the mask bothered him. And then just this week, the LAUSD schools stopped requiring masks outside. And
Yeah.
I can drop off, school starts at 8:15. I can drop my kids off at 7:45. My son has been begging me to take him to school at 7:45 on the dot. And my two other kids that I drop off, I have three kids at the same elementary school. They like to go at the last minute. They like to sleep in. And so I've been doing two different drop-offs, taking my son at 7:45. And when I ask him why he wants to be there so early, he's like, "Mommy, this is the time I can talk to my friends without my mask on my face." You know,
Right.
he cannot wait to
Right.
get to school and see his friends without his mask on his face. And I thought, oh my goodness, like, it really has affected him.
Oh, yeah.
You know, I can see he's so happy to get to school early,
Yeah.
just to socialize in a normal way. So anyways, this whole week I've been doing two different drop-offs, the 7:45, and then
my God.
I go back
You're a good
half hour later.
mama. That is
I don't
so
know about
cute.
that,
But it's also
No,
good
it's
that he
sweet.
can. It's also good he can verbalize that and say that to you. Like, he recognizes how much he needs to be with his friends.
Absolutely. And I think it was interesting for me to see that my kids that don't complain, they do have feelings about this. You know, they have been affected by this, hopefully not in a great way, but I am excited and hopeful that we find that relaxing the mask mandates for kids, giving them choice, is for the better. And I'm very hopeful that it will be. I do think that, I don't know, I guess I should ask you this next question to segue from this. The idea of future variants, because I think some parents are concerned, okay, if we do relax, we're probably going to get a variant coming in the future. They're already talking about, the A2 variant and what's going to happen in future variants. And they're nervous about what if for the future. How would you respond to parents that are worried about future variants as we relax protocols?
I would say we absolutely will get other variants, just like we have a new variant of the flu every year.
Right.
And we are so kind of spoiled in the U.S. at least, where Pfizer and Moderna can quickly update the vaccine. Like, they haven't needed to yet, because we still have good protection against Omicron with the current vaccine. I mean, it's not as good as we'd want it to, but they can alter the formula of the vaccine should a new variant come up that is particularly, that's more severe, causes more severe outcomes, for example.
I know they're looking into one, I think, for Omicron.
They are.
In March.
They are, and it may turn out that we need to get a shot for the variant of the day once a year, once every 2 years. We don't know yet, but as I try to help patients with anticipatory anxiety, because that's such a common type of anxiety. I'm no stranger to anticipatory anxiety myself. Like, I'm the classic anticipatory anxiety person. And I've had to do, lots of therapy to work on anxiety over time. So I'm very familiar with it. It's like I say that I'm a recovering anxious person, but that's kind of one of the most insidious types of anxiety, is worrying about the what ifs, right? Like the what
Yes.
if. And I think what's useful to do is to play it out. I mean, whether it's with your doctor or listening to this podcast or with the therapist, but like, play out the what if. So the what if is going to happen. We don't know when, we don't know, but like, we can't live in a state of suspended animation because of what if, when we have enough challenges to deal with every single day, like doing 2 drop-offs every day, or getting through the day, managing, being a parent, caregiving for elderly parents, living our lives, going to work. So I don't spend any time worrying about new variants, because I know they will come, but I also have faith in our country to get the vaccines up and running when we need them, and it'll just be a new normal. We have to live in the moment and enjoy the progress we've made. We made so much progress over the last 2 years.
Right.
We are not done. We are never going to be done with COVID.
Right.
We have amazing therapeutics, vaccines. We know exactly who's at highest risk for poor outcomes. And so now it's time to work on our underlying health conditions. It's time to start to think about recovering from the last 2 years.
Right.
Be gentle with each other and to ourselves as we make transitions. Kindness is underrated in my mind.
It's nice that you say that. I agree with that. I agree. And I also say to patients, like, it doesn't mean, not worrying doesn't mean we're complacent, right? It doesn't mean that we're ignoring it. But I think if we have a realistic idea that, variants will come, there are going to be future variants. Just know, everyone listening, that there are going to be future variants. It's just the way it's going to be. But we can hope that it will be more mild, because that tends to be the trajectory of viruses over time, that they tend to mutate towards being more, less aggressive. And so, of course, we can't for sure predict the future, but that would be the hope, that it'll be more like a regular respiratory virus, coronavirus, that's more mild in fashion. And hopefully we do have some, hopefully the prior immunity that we've all achieved does count for something.
You said it.
The CDC just said that they think 58% of kids have already been exposed to COVID. Less than that for adults, but between that plus the vaccines, plus more mild variant, I mean, why not be hopeful that things will, that the worst is behind us? Yeah, we've got.
If you look actually at the NIH
vaccines.
If you look at the NIH data hub, and I don't know who I trust more, NIH and the CDC, but I right now I trust the NIH a little bit more, but the NIH data hub shows that seroprevalence, which is the amount of antibodies, like the percentage of kids who, and adults, but I'm just talking about kids for a second, who have antibodies from past exposure, is like in some places in the country is in the 70%. So, and the way that we prevent the severe outcomes from COVID is not but with antibodies. I mean, that is useful to know that we have past infection. That's how you know you've had a past infection. But the mechanism in our immune systems to prevent the severe outcomes is with T cell and memory B cell immunity, so cellular immunity, which you can't measure very easily. But if you take the bone marrow out of somebody who was exposed to the 1918 flu, some of them have T cell nests, to prevent them from the flu. I'm not saying we're going to have 100-year immunity from past infection from Omicron, but I'm just saying the immune system has our back. It has our back, and I think we've hyper focused on antibodies when antibodies are just one tiny little piece of the picture.
Right. No, I agree with you. Thank God for good immune systems.
I mean, thank God.
Yeah, and I do actually really believe. I mean, I tend to be optimistic by nature, but I really do think the worst is behind us. Of course, only time will tell. But I do want to impress upon people that as they hear about new variants coming, hopefully the media will won't be too fear-mongering about it. But
I wouldn't rely on that, but yeah.
But hopefully we can all just remember that, the likelihood is that these variants will be more mild, that with, combination of vaccines, previous infection, therapeutics, good working medications, that it's going to be, of course, not perfect, but much better than we've had since March 2020.
Yeah, and hope and caution are not mutually exclusive, right? We can be hopeful and cautious and respectful of other people at once, right? Hope is not to dismiss other people's experiences. Hope is healthy.
any last advice that you have for any parents listening? You're so good at knowing the data about COVID and also thinking about mental health. Any last things to touch upon that we didn't cover for anybody that's maybe a concerned parent?
I would just say, like, even kids who look on the surface like they're okay, and I think it's just worthy of, like, sort of having a conversation, if your kid is able to, about how they're feeling. Like, what are their relationships like with their friends and their teachers? Like, how are they feeling about their body? Which, these are all conversations that are sometimes not easy to have. Like, how do they feel about going back to school without a mask? Like, what's that going to be like? Do they have excess worry, or do they worry a lot? And if they do, what is it about? How have your moods been? Are you sleeping well? Just kind of a check-in on the sort of mental health inventory, because even kids who look on the surface like they're doing fine can have challenges. Like, I was that kid when I was growing up, like the perfectionist achieving kid, and I struggled a lot. And I wish someone had asked me, like, hey, even though you're getting great grades, and, like, what's actually going on? Do you know what I mean? And I think that
definitely.
it's very easy to assume, just because someone maybe did fine in the pandemic, or gets good grades, or has friends, that they're okay. But I think our internal worlds are complicated. It's not to medicalize or pathologize the human condition. It's not like everybody who's been through a pandemic is mentally ill. It's simply to say that we're human. This has been a massive trauma, in micro ways and macro ways for others. And I think the path forward is with conversations and listening and empathizing and normalizing complicated feelings, because that's part of our health too.
I think that's really good advice. So for parents listening, just to try, and I'll work on this myself, just to make sure we're giving our children time and space to talk to us.
Now, listen, as the mother of 3 teenagers, when I say to my kids, like, how are you doing?
Yeah.
They're like, oh, Mom, I am fine. Like, they know what I'm trying to get at. So with the teenagers, I try to just, like, meet them where they are, right? It's like, I'll be driving my daughter to soccer, and I'll just sort of, she'll just volunteer something, and then we get talking. But anyway.
No, that's true. I find my kids do their most talking when I least expect it. Like, if I take my son on a hike, he will just keep talking and talking to me. And so I'm really trying to do that more and more with him, because I can tell it's good for him. You're right. So you meet them where they're at. Absolutely.
Instead of expecting, like, this burden of, like, you have to spill your guts, like, when your mother wants you to. No, like, just be with them. Be outside. Be in nature. It's good for everybody.
And I do think, for parents listening, I just want to reiterate that although the risk for kids is not zero, it is very, very small. And so as things relax, hopefully we can all trust in that, and know that it is normal for kids to get sick. I mean, it is part of living life, unfortunately. But the good thing about kids is that they, by and large, tend to recover well, which is why I like being a pediatrician.
Yeah, talk about resilience.
Yeah, absolutely. And Lucy, can you tell everybody about your newsletter?
So I started writing a newsletter. I'll just be real quick, but I started writing a newsletter in March 2020, just out of necessity, to my patients, to try to get out as much information as I could, because you remember those days I couldn't pick up the phone fast enough to answer the phone calls. Like, everyone's coughing, short of breath. It's like I was just triaging. Go to the ER, go to urgent care, come to me. And then the newsletter kept going. I wrote. It's been now 2 years, and now it's once a week, reaching, like, over 17,000 people. And I'm basically just sort of dispensing real-time fact-based information that's not political, it's not ideological, it's free. My interest is really to help people who don't have a primary care doctor, because, again, that's 80 million Americans, have some information and a frame around making complex decisions for yourself. So it's been really rewarding. It's actually been really therapeutic for me, because it's also the way I learn, is when I have to learn something and really well, you have to explain it to someone else. So when I have to learn it and explain it, then it really locks it in for me. And so it's been helpful for learning. Plus, I just like writing.
But 17,000 people, that tells you that, I mean, it's spread like wildfire. People are passing it on to their loved ones, their friends, because they are really appreciative and enjoying what they're reading. So I'm so proud of you.
You're so
you probably
sweet.
helped so many people.
I hope so. I get lots of nice letters and notes, and it's really gratifying reaching people who don't look like me, who live in totally different parts of the country or the world, and they're like, I don't have a doctor, and that's the most meaningful to me. I will tell you, it's been fun for me, and I hopefully have helped some people along the way. And yeah, I'm going to keep writing. And you have done 2 guest posts for me, which have been amazing.
Thank you.
Because
I'm honored
it's
to be
really
asked.
great. Well, yeah, it's great to have a pediatrician. You know, again, I totally believe in it takes a village, right? Like I know what I know, and I know what I don't know, and I try to learn about what I don't know a little bit every day.
And if you want to find Dr. McBride's newsletter, go to lucymcbride.com, and I highly encourage you to sign up. It's amazing. I'm a weekly
You're
reader.
nice. You're nice.
Thank you so much for coming on the podcast. I really appreciate your time. It's always a joy and an honor.
Oh my gosh, Jessica, I feel the same way. It's been such a treat to get to know you and to learn from you over the course of the pandemic. And yeah, we'll be in touch. Thanks for having me.